All right, my name is Fernando Ramos. This is my medication administration competency video. We'll be giving medicines to my patient, Miss Agnes Ford, date of birth 5/12/1940. She was admitted today. I'm gonna check my medication administration record, make sure the MR medical record number matches the chart that matches. I'm gonna compare orders. Her orders are furosemide 40 milligrams daily PO, digoxin 0.25 daily PO, for potassium chloride 8 milliequivalents daily PO, warfarin 7.5 daily PO, cephalexin 500 milligrams twice a day PO, diltiazem 80 milligrams daily PO, and insulin on a sliding scale, regular insulin. So I look at my MAR in the chart and compare. So she doesn't get all her meds at 8 a.m., which that's the time now. I'll be giving her 8 a.m. medications. I'm gonna go to the patient's room, perform hand hygiene before I enter. I'm gonna identify myself. Hello, my name is Fernando. I'll be your nurse today. Can you tell me your full name and date of birth? All right. That matches. I'm gonna check her armband. I'm gonna check her MR number. Make sure it matches the MAR and the chart. All right. Everything matches. I've identified my patient. I'm gonna confirm any allergies. Do you have any allergies? No allergies. Okay. Patient states no allergies. Make sure the chart didn't say anything about allergies, and I didn't see anything. No allergies. All right, so for potassium, we gotta make sure in the chart, we gotta see what her potassium was. Labs recently drawn at 0600 show 4.2. So that's a good potassium level, so we can give that. For the digoxin, we gotta get apical pulse, and we got that, and that was 72. That's good. Digoxin level, good. For her furosemide, her blood pressure, which was 146/84, so that was good. Alright, so I checked everything I needed to check. For insulin, I need to check her blood sugar, which was 230 at 0730, so half an hour ago. And I need to also check if she's had nausea. Is she NPO or not? Has she eaten? Alright. So after I got all my checks with my patient, allergies and appropriate vitals and labs that I need to confirm for the medicines I'm going to give, I'm going to go ahead and go to the Pyxis. what I'm pulling on the Pyxis for 8 a.m. is going to be, so her blood sugar was 230, so on a sliding scale, we're going to have 4 units subcutaneous. 0.25 milligrams of digoxin PO. Let's grab that. And potassium chloride, 8 milliequivalents PO. Alright. And furosemide, 40 milligrams PO. Alright. So I have my furosemide. It's in date. It's the right medicine, right dose. Potassium chloride, 8 milliequivalents, so it's the right medicine, and it's in date. That's the right dose. The digoxin 0.25 milligrams, and that's the right dose, and it's in date. All my medicines are in date. My insulin, clear. It's a multi-dose vial. It's in date. It's the right medicine. Regular insulin. All right, so I'm gonna perform hand hygiene before I go back to the room. Hello, I'm Fernando. I'm your nurse. I'm back with the medicines, okay? You state your full name and date of birth. All right, let's act this forward. And I look at MR number, make sure it matches, and her name and date of birth on her wrist, her armband. Make sure I don't see the presence of any allergies, allergy bands, and ask her, do you have any allergies again, just to reconfirm. Okay, so I reconfirmed her identity, no allergies. I'm gonna gather my medicines and my equipment, which is my insulin needle, my medication cup, my cleaning supplies for the skin, and for the vial. Alright, so I'm gonna be giving regular insulin, 4 milligrams, 4 units, sorry. 4 units. Alright, so 4 units of regular insulin. Digoxin is 0.25 milligrams. It's in date. It's right dose. Regular insulin. Insulin looks good. It's clear. It's in date. And it's the right medicine. Regular insulin. The potassium chloride, 8 milliequivalents. It's the right dose. Right medicine. Right date. It's in date. And finally, the Lasix furosemide. It's the right dose. It's in date. It's the right medicine. So I got all 4 medicines. So I'll be giving her Piomed first. All right. Let's reconfirm. Digoxin, 0.25 milligrams. All right, it's in date. All right, now it's potassium chloride, 8 milliequivalents. It's the right medicine. It's in date. And the last one is Lasix furosemide, 40 milligrams. It's the right medicine, right dose. It's in date. Okay. And she'll take it with water. And she likes taking it all at once, and that's okay. Alright, so now it's the regular insulin. So what I've done, I've pulled back to 4 units. I'm gonna go to my vial, take off the top, clean off the top, uncap, press down, push air, flip it upside down, put a little 4 units. Pulled 4 units. Alright, so I'm gonna give it subcutaneously. I'm gonna give it in her stomach, in her belly. I'm gonna clean the area inside out. I'm gonna perform hand hygiene, have gloves on. And then I'm gonna grab a portion of the stomach, some fat, get my insulin needle, and inject. Alright, sharps. Alright. So she received that. Now I'm done. I'm gonna throw away all my medication trash, equipment trash, and then document any reactions immediately or not. And then I'm gonna go and chart what I gave, what I checked, the time I gave it, and everything I need to. As I'm leaving the room, and hygiene again. Like I said, document in the MAR. That's it.